Hi Freya, how are you doing today?
Hi, I'm good, Charlotte. How are you?
Yeah, very good. I just wanted to have this little conversation with you so that we could let the speech therapists out there know about Estill Voice Training and how it might be helpful, useful for clinical practice. So, who are you working with? Who and where do you work at the moment?
Yeah, absolutely. So I'm a speech therapist working at Barts Health, which is a big trust in the east of London. And my clinical practice really is within head and neck cancer and ENT conditions. So a really kind of wide range of things really that can affect the voice. And I'm also a clinical researcher, so doing some research into voice therapy after throat cancer as well.
Right. Okay. So lots there. And you came on the Estill Level 1 and 2 course with me a few months ago, and since then we've been in dialogue about how the model might be useful. And you've been teaching me a little bit about the clinical world because my background's theatre. But just first off, let me know how you found the 5-day training course as somebody who's coming from the therapeutic perspective.
Um, I found it really fun, and I learned a lot actually. I think when you come from a clinical practice, you're taught your anatomy and your physiology, and you're kind of taught how that um, obviously relates to a voice production and a voice quality. But I think we don't often get the chance to explore that a bit more, to play a bit more with that, and to be more comfortable with actually how does all that come together in function. So um, with the training, I think what I really got from that is just actually having that really good amount of time, 5 days, to really explore different uh, parameters of the voice and to really think in a lot of detail. Actually, if I want to change somebody's voice, what are the things that I can do? What can actually be modified? And also I think because it's a very practical training and you're learning how to do that yourself in order to help somebody else, that's a really important component, I think. That might be important for speech therapists to know, because if you are coming from a place where actually you've been taught in a more sort of anatomical, theoretical kind of way, you might not have had that chance to actually see what your own voice can do. So that might be something that sounds a bit daunting to speech therapists, but I
Mm.
think I really quickly found that it was comfortable and there was no kind of pressure, and you're not going to be asked to do anything terrible or sing an aria. So
Right.
the people can sort of let go of that if that's a worry, I think, as well. Mhm.
How did you find it being in a course with people who do perform professionally, who are in that world? How did it feel being a participant alongside those types of people?
Yeah, well, I think going into that, when we first kind of got there and people sort of introduced themselves, yeah, my initial reaction was, oh my goodness, this person's an opera singer, or this person's a really sort of in musical theatre, and I suppose there was a moment of nervousness about that. But actually, what I really quickly found is that when you come to the practice groups, actually, even people who are performers, because they're having to think about their voices in quite a different way, and to maybe really break down and maybe to kind of do things in a way that is quite different to how they've been trained, I think that makes a really level playing field and it makes it really accessible. And actually, I was surprised to find that a lot of the performers were kind of almost a bit um, how can I say, interested in me as a speech therapist, in terms of, oh, what do speech therapists know and how do they learn? And so actually there was a really nice kind of sharing in that way as well.
What parts of the course do you take away and action, if you like, that are actual practical tools that you can put into play in your own context? Could you give us a little bit of detail about that?
Yeah, I think there's a few ways. I think there's how it's what I've taken sort of personally in my own voice use, and I suppose what I am using sort of professionally to others. So Personally, I think what I gained from that is a good understanding of my own voice, and feeling more confident in what I can do and kind of what I can continue to explore there, which if you're working in voice therapy, I think is a really good thing to be able to do. In terms of my work, so working within voice therapy, there's really quite a lot that I still can apply to that. So having that understanding of the different subsections of the vocal tract and how they might affect voice quality, and being kind of really clear about what you are perhaps manipulating if you change something there. I've found that that applies really well to people with voice difficulties, or people that don't necessarily have a pathology with the voice, but actually might have a quality in their voice that they're struggling with or they want to change. And we've talked a little bit as well about, you know, the potential of that after throat cancer, which is a slightly different caseload. Perhaps people might not think immediately of that caseload when they think of Estill. But actually, you know, there's a real logic there that if someone has had an impairment or a change to their anatomy, thinking about the other parts that are intact, the other parts that can be modified, I think is a really interesting potential area for use of Estill by speech therapists.
That's so helpful, Freya. Thank you very much for giving us your insights.
You are really welcome. Yeah, and yeah, I would just encourage people to do it, have fun with the course, and I think you really learn a lot that you can take into your practice. So yeah, go for it.
Thank you.